So how's med school going? If you were like me, not very well. I mean, we all knew it would be hard. We all knew it would be stressful. We really didn't expect it to be so unpleasant. And the reason that it's unpleasant is because you try and try and try, and you just don't get the result you want. And there's a reason for that. All the things that you've used in the past, memorize, look at the exam questions, write the exam, and move on, aren't going to work in medicine. And they don't work in medicine because medicine has to build blocks of knowledge for the next thing you do. I can't teach you about heart disease if you don't have the anatomy of the heart. But it isn't just any anatomy of the heart. You've got to learn the heart the way doctors see the heart, and they all see it through echo. So if you're not learning the heart anatomy by the short and long axis of echo, you can memorize that anatomy till the cows come home, and it's not going to get you a good result. Performance equals talent times effort times directed effort squared. You're not going to do better by trying harder, and you're not going to do better by memorizing, because memorizing doesn't tell you why you're learning a fact and how doctors use it in clinical reasoning and treatment of disease. All of this means you're going to have to change. And the American military actually has an expression for this. It's called embrace the suck. And that means when you have to be prepared to do something that's hard, it really hurts and it's really unpleasant. And what we do is we try to grit it out. Embrace the suck does not mean grit it out. It means we're giving you this stress because we want you to change. We want you to stop memorizing, and we want you to start having a picture of things that we tell a story through. Humans are great at pictures. We love stories. And when you learn the anatomy of the heart through the echo, you'll want to know it, and you'll be able to use it forever. And you go from being miserable to actually looking forward to the next thing. So you're going to have to change. You can grit your way through memorizing. You can sort of get to a marginal low pass. It's never fun, and it doesn't prepare you for exams or clinical medicine. Changing away from a lifelong practice of memorizing, writing the exam, dropping it, moving on, is not going to work in medicine. It's not going to work when you get to the clinical wards, and it's not going to work for your exams. So you're going to have to change. Change is really uncomfortable. This is not about trying harder. This is about doing things differently, and it's really hard to let go. But what we're going to tell you is medicine is about having a mental picture of something, and it has a story to go with it. You can anticipate it's going to make you anxious. It doesn't feel right. It's not normal not to be memorizing. It's extremely powerful. Learning hurts. Knowing is fun. You've never had the pleasure of knowing something and mastering something. Before we go deeper, come join us. Hit subscribe. Every week now, we're going to be posting a video on how to change how you study so that you're doing patient-centered learning and not just memorizing. So this is going to be a whole learning environment. It's not going to be just a sterile, learn this picture, here's the story with it. To be sure, there's lots of that. No one said this is going to be easy. It's just going to be useful once you know it, and you'll keep it all your life. But we're going to bring in students that have gone through the embrace the suck. You're going to laugh. You're going to see yourself, and then you're going to go, but they really are better, and they're going to tell you, oh, I'm the best in any group I walk into. We're going to talk to my very close cohort of doctors that have started to teach this way, and you can have great laughs about how painful it is for us to learn. I had one of my practice partners come join me teaching, and he called me after a week of preparation and said, wow, we really didn't know why we did anything, did we? But now we do. And I'll tell you, the most exciting thing I can tell you is one of my teachers who's been teaching with me for 5 years, he's going back to clinical practice. And he says he wants to see if he's better because he's been teaching patient-centered pathophysiology for 3 years now. So come join us. There's going to be lots of different voices with lots of different experiences. And I assure you, all of us are going to share the misery and the pain of learning to do it the right way. I'm Dr. Philip Tisdall. I came from many decades of practice in clinical medicine. I had a broad, small hospital practice in northern New England of general pathology, and it turns out that's really good for teaching because I have a very broad experience running labs, doing autopsies, forensic autopsies, building new genomics lab. Really, over 40 years, you really get to do a lot of things. And then no one more surprised than me. In my 50s, I discovered I really liked teaching. And so, my affairs had prospered, my kids had gone to college, and I just launched into teaching. So I've been teaching over 10 years, probably most of it prep for step one. So I've probably prepared 3,500, 4,000 students for step one. And believe me, when you teach in the commercial world, you guys rate me every day on whether I'm funny that day. And then you rate me in a month to see if I helped you on the exam. Boy, I haven't just been teaching, I've been measured every step of the way. And finally, I just kind of got tired of repeating myself. So I took all of my lessons and I wrote a 2-volume book. Here it is. And I'm telling you, this is 70% of medicine and therefore 70% of your exam. Clinical medicine is built on a foundation of basic medical sciences. And we call that clinical pathophysiology. You get my entire brain in one book, and you're going to join a community where you're going to rediscover medicine is a subject to love, which you've never heard anyone say before of it. Today, we're going to talk about why step one prep seems so overwhelming. And the first answer is because it really is high stakes. You can't fail this exam. And the second is, you've been memorizing for 2 years and you don't feel in control of the subject. And that's true because memorizing will only get you so far. You've got to start patient-centered, clinically based learning. And that's going to mean you're going to have to change. And we can do that fast or we can do it long. We can do it any way you want. I promise you it will help. That change, we use an expression, embrace the suck. We're not asking you to endure this. We're telling you you're going to have to do it differently. So embrace the suck is something that we learned from the military. And, for us boomers, we grew up on the war stories of our fathers in Europe. So I can tell you all my father's war stories. But I actually had 2 kids that went into the military and they saw action in our recent wars. And they brought back this expression from special forces, and it's embrace the suck. Don't complain about the suck. Embrace the suck. You're going through this discomfort because it's going to get you to a place you need to be, being taught to you by people like me that have been in practice for more than 3 decades and have been teaching for exams and learning for more than a decade myself. You have to do this. Embrace the suck. And let me just remind you, learning hurts. Knowing is fun. You've never had the satisfaction of really knowing what's going on. I can only tell you it's worth any pain you give us. It is the greatest feeling in the world, and we're going to give you that. So let's talk about why the step one exam is so difficult. It's because you've been learning subject-based learning, anatomy, physiology, biochemistry. The exam is going to be clinical, meaning why did you learn those facts? How do those facts work in patient care? And the way you should think about it, write it out and tape it to your bathroom window so you look at it every morning. Clinical medicine is built on a foundation of basic medical sciences. And it turns out you can't really, as a medical student, look at a clinical vignette and really in a logical, clear way say, here are the basic science principles it's built on. So when we talk about what you're coming to us, is that we're going to switch you from subject-based factoids to asking yourself, how do I use those facts in patient care? And it's something you can't do for yourself. But once you learn this way of doing it, it's so powerful. And there's a real joy in it to walk into a vignette and say, well, let's walk this all the way through to the cytokines, shall we? There's a great love of medicine that no one's ever shown you before. But in our community, we love medicine. Let's talk about why it's so hard to change from memorizing to having images that we tell stories through. It's because of the really deep anxiety that we all have. And we all have it. I mean, there's nothing to apologize for. But when you're anxious, you go to ritual behavior. You go to things that you've done in the past. And we've all grown up memorizing, writing the exam, and moving on. So when you feel this great anxiety, you're going to get out your first aid and you're going to memorize all the facts in it. And I'm telling you, it's only going to take you so far in the exam. There are brilliant memorizers who pass by doing it that way. Yeah, it's not good and it's not for most of us. You have to know how those facts are used in patient care. You have to learn to think like a doctor. Clinical medicine is built on a foundation of basic medical sciences. So when you have someone with shortness of breath, why do they have shortness of breath and congestive heart failure? You've got to be able to walk that all the way through from patient to molecular. It's not easy to quit memorizing. It's really uncomfortable to have a new way of thinking that demands you let go of the past. What I'm telling you is expect that discomfort. As you start to see these tools, even a few days is enough, but it involves practice. When I say to you, do you have a mental image of left ventricular congestive heart failure, and I show it to you, I'm telling you this because it's true for me. You have to write it out 10 times before you can write it out perfectly once. And then you're going to get up every morning and you're going to practice it. You're going to watch me up and you go, oh, look at that guy doing his fantastic job. This is brilliant. What no one understands is I've done it, I don't know how many times, hundreds, thousands of times. Before I do it for you, you know what I do that morning? I practice it again. So don't think this is easy, but it's really powerful. Here's a metaphor for those of you that are athletes. Did you really think that when you were doing your weight and speed training in the gym, it would be fun? Or did you recognize that that pain was a necessary precondition to then have those powers to go to your other? So when you say to me, tell me how that compares, I'm going to tell you this is training for the brain. Did you think it would be easy? Did you think it wouldn't hurt? It hurts. Learning hurts, but knowing is fun. So when I say to you, left ventricular congestive heart failure, you'd better have the same picture as me, because I'm counting in that discussion, we have a mental image we're both using. So when I talk to you about, oh, let's talk about paroxysmal nocturnal dyspnea, why do they have bronchospasm? You've got to have the same picture of me. It's not words. It's a story with a picture underneath it. What I'm going to ask you is no different than hitting the gym and getting weight training and getting speed training. No one said it would be fun, but it sure is fun to have that power when you go for the ball, isn't it? So when we talk about learning from a patient-centered basis, and that pathophysiology is a mental image with a story running through it, I'm telling you this is the exact same as learning a language. If you go to Language Lab and memorize all the verbs and memorize all the nouns, hey, go out to the marketplace and tell me, how's it work? You're useless. Yeah, you're useless because they taught you everything, but it turns out everything isn't equally important. It turns out how much does that cost and where's the bathroom are way more important than whether that's Angora wool or not. And so the trouble with most of your teaching is they haven't told you what matters and what doesn't. Oh, trust me, we're 80-20 on anything. We're only going to teach you the 80% that you need. There's another idea that's very comparable to language. Words don't have meanings. Meanings have words. So when I say to you, congestive ischemia, do you have a full understanding of what I've said? Because if you don't, it's clear to you, I think it means something. But then you stop to try to understand that, and I've moved on the next 5 things, and you've lost the thread of the thinking. So for you to learn what matters more than other things, and understanding the ideas of language, all of a sudden you have the same mental image as I'm talking to you. And people come to me and say, well, the questions are kind of easy, aren't they? And they go, well, yes, if you know the language. If you're ready to give up memorizing and you're coming over to think like a doctor, hit subscribe. We're going to be putting out material regularly now. If you want to follow this, remember to click the notification bell. Every week, I'm going to be putting out a new thought on how you can learn medicine through a patient-centered approach. Remember that everything is going to be basically my brain in a book. So this is our book. You're going to need it. It's all the ideas and the vocabulary that we use. And you're going to want a copy of that when you hear something in the discussions so that you can go and refresh and deepen your understanding of it. So if you want the book, remember to click the link in the description. If you like this video, then you can go check out the previous video on Step 1 Anxiety. Next week, we're going deeper into what patient-centered learning means, and we're going to be discussing the chief complaint and its differential diagnosis. I'll see you there.